Menstrual clots are jelly-like lumps of coagulated blood and tissue that sometimes appear during menstruation. They can range in color from bright red to dark brown or even black. The presence of clots is a normal part of the menstrual cycle, but understanding why they occur can help distinguish between normal and abnormal situations. What causes menstrual clots? During menstruation, the body sheds the lining of the uterus, endometrium, if there's no pregnancy. The uterus contracts to expel the lining through the cervix and vagina, and in some cases, the blood can coagulate, clot, before it exits the body. The process involves the following: endometrial shedding. The uterine lining thickens every month in preparation for a potential pregnancy. If no fertilization occurs, the lining breaks down and is shed during the menstrual cycle. Blood flow and clotting. When the lining sheds, it includes both blood and tissue. The body naturally produces anticoagulants to keep the blood flowing. However, if the blood flow is heavy, the anticoagulants might not break down the blood quickly enough, leading to clot formation. Uterine contractions. The uterus contracts to push out the menstrual blood, but if the flow is too fast or the contractions are strong, the blood might form clots before it leaves the body. Appearance of menstrual clots. Size. Menstrual clots are usually small, about the size of a dime or quarter. Larger clots, bigger than a quarter, can sometimes indicate underlying issues. Color. They range from bright red to dark brown or black. Darker clots are typically older blood that has been in the uterus for a longer time. Texture. They often have a jelly-like or lumpy consistency. When are menstrual clots normal? Small clots during a heavy flow, especially in the first few days of your period, are generally normal. Your body might simply be shedding a larger volume of blood at once, which leads to clot formation. When should you be concerned? While clots are typically normal, there are cases where they could signal an underlying issue, especially if accompanied by other symptoms. You should consult a healthcare provider if clots are large, bigger than a quarter, and frequent. Your flow is unusually heavy, soaking through a pad or tampon every hour for several hours. Severe cramps or pain accompany the clots. Your period lasts longer than usual or is irregular. Possible causes of abnormal clotting. Hormonal imbalance. An imbalance of hormones like estrogen and progesterone can cause the uterine lining to become thicker than normal, leading to heavier periods and larger clots. Fibroids or polyps. Non-cancerous growths in the uterus, fibroids, or on the uterine lining, polyps, can cause heavy bleeding and clot formation. Endometriosis or adenomyosis. Conditions where uterine tissue grows outside the uterus or deep into its walls, causing heavier periods and clots. Miscarriage. If you're pregnant and experiencing clots with heavy bleeding, it could be a sign of miscarriage. Blood disorders. Rarely, blood clotting disorders or conditions like anemia can affect how blood clots during menstruation. Treatment. If clots are a result of heavy menstrual bleeding, treatment might include hormonal birth control to regulate menstrual cycles and reduce bleeding, non-steroidal anti-inflammatory drugs, NSAIDs, to reduce menstrual cramps and heavy bleeding, surgery. In cases where fibroids, polyps, or other uterine conditions are responsible for excessive clotting, surgical options may be considered. Drink plenty of water to make the blood flow easily. You might want to add some exercises to your routine. If you're concerned about your menstrual clots, speaking with a healthcare provider is the best way to ensure everything is normal and to discuss potential treatments if necessary.